at the granular level where the attack actually happened. And that's where I've been privileged and honored to serve for 5 years, reporting in Lower Manhattan about the consequences of what happened to working people and essential workers in the aftermath of 9/11, and indeed the tens of thousands of Lower Manhattan students and community members, even folks in Western Brooklyn, throughout the whole region, really. Because what happened was, and this presaged what's happened with the Trump response to the pandemic, in the immediate aftermath of the attack, where 16 acres was laid to waste, the EPA, under the direction of President Bush, with Christy Todd Woodman as the EPA head, advised people the air was safe to breathe within a couple of days. And at the time, the thought was it's important to show the world that the United States could not be laid low by a terrorist attack. And Wall Street was what is in close proximity there. So tens of thousands of people from around the world, but a heavy concentration for this tri-state region, spent months on top of what was a huge, unprecedented funeral pyre, where they were digging for relatives, colleagues, and coworkers under the belief, which was a lie, that the air was safe to breathe. The fires continued to burn for a period of time. The city of New York ordered some 19,000 school children back into schools within the area that was toxic, which included portions of Western Brooklyn and things south of schools south of Houston. And so, as a consequence, later on, we learned through the EPA Inspector General that the EPA had actually suppressed information that showed the air was like, Drano. And subsequently, what resulted was we now have more people that have died from occupational exposures, and tens of thousands of people, some 50,000 people, who are involved with long-term healthcare concerns through the World Trade Center Health Program. This is a narrative that has been largely lost. And as you see with the rise of Mayor Giuliani, this was something he did on his watch, where he made a calculation that it was more important to operate Wall Street and get Lower Manhattan up and running than think about the long-term health consequences. So now the city of New York and the teachers unions and other unions are trying to find some 19,000 young people. And there's a group called Sty Health, which was started by a visionary young woman, Nyla Nordstrom, because these kids need to be advised, who are now young adults, that they have a health exposure. There have been some that have died as a consequence. So this really mirrors what's happened with the pandemic, in the sense that we've been told that there was nothing to worry about. We were told all kinds of things happened in terms of guidance from the CDC that turned out to be erroneous, whether it was using masks that should be used for one clinical encounter, an N95 mask. Nurses, when the CDC, concerned about inventory control, said, no, forget what you've learned in nursing school, forget what you've learned in med school, but use your mask across encounters. The nurses warned two things would happen, Rick. One, that they would die as a result of the exposure, and that hospitals would become a vector for the disease. Both things happened. Similarly, we see now in May, when the CDC ordered the lifting of the universal mask mandate, even for people vaccinated in public interior settings, the very same unions begged for them to wait, because we saw that that decision left behind millions of Americans for a myriad of reasons who are not vaccinated. As we speak today, the CDC has retracted that guidance and is now echoing exactly the same concerns raised by public health professionals and the union movement.